Good evening, friends. Meeting again in the session of Materia Medica. And since last two lectures, we were discussing regarding the very important remedy in our day-to-day practice is the Nux Vomica. We have learned the constitution of Nux Vomica, the mental state of the Nux Vomica in detail, how the person is, how his nature is, how he presents to us. Because the first few paragraphs explain the constitution as well as the presentation with how a patient approaches to you, and that's what we have discussed in detail. Thereafter, in the yesterday's lecture, we have learned one more thing, that is the specifically related with the bad effects or elements from specifically in Nux Vomica state. So many features with which the Nux Vomica presents and Nux Vomica reflects, those we have discussed. There are bad effects of all stimulants which we have seen. The coffee is there, the tea is there, the alcoholic stimulants are there. Patient is so sensitive to the external impression, he easily get grabbed the draft of air. So many more which we have discussed in length, and everything is a very important thing which we have to take into consideration as a cause and effects, and both reflects the Nux Vomica. So we have discussed all those things. Today I will going to share one case, and thereafter we'll enter into the again into the Nux Vomica from Alan Skinner. He was a young man, nearly about 22 years, unmarried, who came to me. He was having a severe orchitis, and along with that, he used to get a severe seminal emission. So that was the thing with which he was presented, and he used to have a tendency towards the little bit masturbation. At the same time, his thoughts were very amorous. Asked, what do you do? He said that he is an office worker. He used to sit for whole day, and whenever the time permits, he used to go on net and see the ponds and all those things. Then I have asked him what's your office timing, and he said right from 8 o'clock till night 8 o'clock. I used to sit in my office. I'm doing the work. I am a person who used to connect many people over there in my office, and I have to be continuously on the net over there, and that is my work. And he said that since last one and a half years I am suffering from this problem. I have shown to the many doctors, but they said that it's normal, everything. And they said there is little bit swelling in my testes, etc. But whatever the medicines they gave, it never worked properly. What happens actually, I have severe pain in the testicles, and it happens to be there whenever I get insemination and sexual, because of sexual thoughts. At the same time, whenever this happens, I get severe burning in whole spine, and specifically at night it burns a lot. The person was absolutely sedentary worker. He was not doing any type of exercises, and used to be very much addicted to the tea and coffee, both things, as a stimulant he required in the office continuously. So the case was very clear that he is a young person having this problem as an acute trouble with a typical presentation without any direct pathology known. So I have decided to give him Nux Vomica. Question was that how much potency Nux Vomica should be given in this case. I have examined clinically, and I found that there is no actual swelling, but little bit tenderness was there on the testes. So I decided to start with 30 in repeated doses, and asked him to come and meet me after 10 days. It was way back when I was generally prescribing remedies for 10 days, and after 10 days, I used to take the follow. So I asked him to meet me after 10 days. And when he came after 10 days, he was absolutely a different person. He said, Sir, what you have given to me? Because my whole problem disappeared. Basically, I get relaxed. I used to get irritated every time earlier. That has also settled. Second important thing, that my sleep has become normal. And I feel that I'm a little bit peaceful nowadays, I'm feeling. And that pain which happens to be there, and the I used to do masturbation many times. All those things that have disappeared from my mind, and I'm stable at that level. See, Nux Vomica is very important remedy in especially having the action over the male genital system in the form of this spermatoria, sexual excesses, then orchitis, testicular pains, all those things associated with backache, associated with the spinal burning, all those things which are characteristically present in Nux Vomica, which we generally miss considering this is a GI remedy. So this case taught me a lot regarding the action of this specific remedy on the male genital system, and it has produced a very acute result over there within span of 10 days. So this remedy is a wonderful remedy which we have to learn from the aliens, and today we're going to learn something again. So we'll go ahead with the remedy. We have finished up to the bad effects paragraph. We'll go ahead. One of the best remedies with which to commence the treatment of cases that have been drugged by the mixtures, bitters, vegetable pills, nostrums, or quack remedies, specially aromatic or hot medicine, but only if symptoms correspond. And that has been written in italics. And this is more important. Many people start treatment of every patient with Nux Vomica because he has came from the allopathic treatment. It's not so good. Unless and until the state defines the Nux Vomica, you should not give the Nux Vomica. Nux state should be there. So yes, this is the one of the important thing, because generally all those allopathic medicines, when patient suffers from typhoid, patient suffers from malaria, patient suffers from dengue, generally because of those medicines he enters into that specific state. This is the thing which happens, but it is not always that patient enters into that state. It is not always that patient will enter into Nux Vomica and patient will come to you as a Nux Vomica. Many times it happens because they are the medicines which are very strong in their actions. It produces a severe gastritis. So, in all those disorders where the complex fevers are there, and people, allopathic practitioner gives strong antibiotics along with antimalarials. Generally, antimalarials they produces severe gastritis. At that time, Nux Vomica plays very vital role. So, if the patient goes into the state of Nux Vomica, that means he becomes absolutely irritable, sensitive, nauseated. He wants to vomit, but he can't. There is severe retrosternal burning. He craves stimulants and he suffers from constipation with urging. And his face is always like that, with a frowning, with irritable state. And that is what is the Nux Vomica. And if that state is present after taking all those medicines, then definitely Nux plays a very vital role. You give the Nux and followed by your whatever his remedy is there that are. But Nux plays very important role, specifically in such types of cases. So if you read this paragraph, understand that given in italics, but only if symptoms correspond. Convulsions with consciousness, strychnine. Yes, this is very important. Convulsions with consciousness. Patient gets an epileptic attack, convulsion, but he never gets unconscious or semi-conscious or a stupor state. He is conscious. He knows that he got the convulsion and he explains the convulsion. That is very typical with the Nux. Strychnine, its derivative. So it is also having the similar symptom, convulsion with the consciousness. So and there is a similarity because it's a derivative of the Nux Vomica only. Convulsions with consciousness aggravated by anger, aggravated by emotion, aggravated by touch, and aggravated by moving. So the person is so sensitive that he gets immediately a convulsion whenever there is an emotional setback. When his ambition gets deceived because of some reason, when he gets so angry, at that time also he gets convulsion. Whenever someone touch is not always a physical. At the mental level also, if it get touches, there is a problem. And moving also aggravates the complaints, the convulsions in cases of Nux Vomica. So Nux has very characteristic is that convulsion is associated with the consciousness that you underline. The consciousness remains persistent in those patients. Then he explains about the pains of Nux Vomica. So what are the pains? What type of pains? Pains are tingling. Tingling means there is a little bit, in Marathi we can say, झुंझुने आहे ना, मुंगे आहे ना. That is tingling sensation. Sticking, as if something has sticking over there. Hard. Aching. Aching in Marathi we call it rag lagna. Pains are tingling, sticking, hard, aching. Aching is a continuous type of pain. Persistent over there is called as aching. So pains are tingling, sticking, hard, aching, worse from motion and contact. So motion aggravates is very important entity which is there. Contact means here touch. The patient is too sensitive. So slightest touch aggravates the pain. And patient never allows to touch them. That is very typical. Patient is too sensitive to the pain and he never allows you to touch that painful part. That is typical with this remedy. Same is true with the colocin also. They never allows you to touch. But if you press hard, they feels better. So these are things which you have to catch over there. Tendency to faint. Tendency to faint means they feel giddy and they feel as if they are falling down. Nux moschat and sulfur, these are two important remedies which are there. But this why this fainting comes? The fainting comes because of from orders. The strong orders because of which they get the fainting. They get fainting in the morning, tendency to faint, especially in the morning. Tendency to faint after eating. And last modality which he has explained that tendency to faint after every labor pain. This is again one important thing which you can utilize in your obstetric cases. I used to try in obstetric cases the homeopathic remedies and they have wonderful results in obstetrics. Only thing is that we have to catch the states. And if you are able to catch, you utilize and see the results, which gives instantaneous results in the patient. We have utilized the colophyllum, we have utilized the semicipiga, we have utilized the pulsatilla many times, pulsatilla, even sometimes arnica. So many remedies we have tried over there in the IPD, especially in the on the obstetric table. This is one should not forget where there is a pains which are tendency to faint, especially after every labor pain. So patient goes into the fainting state, again pain comes and again he awakes. That is another state in which this remedy is useful. Gelsemium, the same state is there, but gelsemium, the person becomes absolutely drowsy in between and patient is absolutely thirstless during labor case. That is typical and exhausted, debilitated, never have strength to take the pains. That is the gelsemium. Cannot keep falling asleep in the evening while sitting and reading hours before bedtime or reading hours before bedtime. So patient is sleepy in the evening period. The sleep is very characteristic of this remedy. Early in the evening, early at the night, the patient feels sleepy. If he starts reading, he feels sleepy and he sleeps. So that is early. He used to get into sleep or very early. So reading hours before bedtime and awakes at 3 or 4 a.m. And that is very typical with the nurse. They gets up at 3 o'clock, many times even 2 o'clock, and thereafter they never get early sleep. They remain awakened during that period for longer period. And thereafter awakes at 3 or 4 a.m., falls into dreamy sleep at daybreak, from which he is hard to arouse. So thereafter, after 2 hours, they get sleepy and they goes into dreamy state. And then it is rather difficult to awake them, to bring them out. And that is very difficult. So the first sleep is good, then there is a disturbance, and again the persons are sleepy, very typical. And then feels tired and weak. See, then feels tired and weak. So early in the morning, They're absolutely tired. Well, this is very important thing one has to understand. So if you are writing the sleep of the Nux Vomica, there is first clear sleep, then dots, and then again a sleep. But when patient wakes up at morning, he is not at all free. Second, there he has written reverse of pulsatilla. Pulsatilla, it is characteristic that they never get sleep early. They remain awake for longer time of duration in the bed, and then they get sleepy. And then after that, when they arouse, they are also not fresh in the morning. That type of sleep which is mentioned in the pulsatilla. So it is completely opposite in Nux vomica and pulsatilla. There was some question, someone have question regarding the sleep. Any query you can ask? No. Okay. So this is one important thing one should not forget. Generally, whenever I used to consider this is Nux, I always put two questions. First important question is related with the sleep. How is your sleep? Because that confirms many times your remedy. These people talks about this typical sleep that they are always remains specifically sleepy at the early in the night in the evening, and they wakes up at midnight and then they never get sleep again. That is very typical with the nux state. Then he turns to explain the particulars and he explains about the nasal complaint. Generally this also we forget in nasal. There is one important feature on which you can think of nux vomica many times. There is alternate nostril obstruction is there in nux vomica. One nostril there is obstruction, then later it opens, then another gets closed, and this alternate obstruction of the nostril is the very typical feature of the Nux vomica. So that is one important thing. Second important thing, they are very sensitive at nose, very sharp, very sharp. So they are very sensitive to the any type of smell that is typical with the Nux vomica. There is a inflammation of the mucous membranes. Catarrh, it is a very important thing. Catarrh, snuffles of the infants like ammonium carp and Sambucus nigra. Sambucus never fails in infants. It is the remedy of first choice in infants whenever the snuffles are there, the obstruction of nose associated with little bit sneezing and little bit discharge from the nose. The first remedy you must think in infants is always the Sambucus nigra. If it fails, then you can think about the Nux vomica as an acute. And ammonium carb, it is not an acute, it is chronic, especially in children, small children, where the carbon constitution is there. And you feel it might be calcare carb, but many times it is not calcare carb, it is ammonium carb, which is close to the calcarea is ammonium carb. Catarrh, snuffles of infants, choroids are dry at night, fluent by day. So the daytime there is a watering, there is a nose, nasal discharge, and at night it becomes completely dry. So this is very typical with the cutter, aggravated in warm room and ameliorated in cold air. See the modality, aggravated in warm room like alimsipa, ameliorated in cold air. Catarrh from sitting in cold places on stone steps. So whenever patient sits on cold steps, anywhere and they get starts getting the sneezing, they get starts getting the watering. So this is very typical of the Nux vomica, and these modalities defines the Nux. Here he has not mentioned about this alternate obstruction, but if you open the Boyke's Medica or even in repertory, it has been very specifically mentioned. The alternate obstruction of the nostrils is the Nux vomica over there. Dr. Amit has asked one question, sir. What potency can be thought for snuffles? 30 is better. I used to give the 30, and few doses are sufficient. It is not repetition is not needed even when you use Sambucus or even when you use the Nux Vomica. If in cases of infants, if you are giving no repetition, because they are quite susceptible. So you should not repeat too much in infants. That is one thing. Always keep it in your mind. Whenever you are prescribing for the infants, you should not repeat too much because of hyper susceptibility. Okay. Then he starts with GI trouble, and GI troubles are most important features of the Nux Vomica. Eructations. Eructations are sour, bitter, nausea and vomiting every morning. What is it? Nausea and vomiting every morning with depression of spirits. Eructations after eating. See, this is very important. Sour eructations, the bitter eructation. There is a nausea, there is vomiting every morning with depression of spirit. They get disturbed because of it. They feel why this is happening to me. Why every morning I used to get the vomiting? Why every morning I have to vomit it out? They have a tendency to put the fingers in the mouth and try to throw away whatever contents are there. And many times they fails, but they feels better. Even slightest amount of vomit comes out, they feels better. Eructations after eating, that is another feature which is there. Every time they eat and there are eructation. Nausea. Nausea is constant, like ipecac. Ipecac, it is the characteristic with each and every complaint, the nausea is persistent in ipecac. But what is the difference? How will you differentiate Nux Vomica and ipecac? Basically, the thirst. Ipecac is absolutely thirstless. Nux is not thirsty. That is the first important thing which you have to catch over there. Second important thing is the tongue. Tongue is very characteristic in ipecac. It is absolutely clean in ipecac. So you have to understand all those things. Nausea constant, especially after eating in the morning. Nausea from smoking, that is very specific. Nausea after smoking. Patient smokes and he starts getting the nausea, and still he smokes because there is tremendous craving for smoking which is persistent in this. And nausea and feels, if I could only vomit, I would be so much better. And underlies this sentence, patient talks in the same sentence. He talks, doctor, by any means, I want to vomit it out. I tries a lot. And they have the tendency to put the fingers and try to vomit, and that is that tendency itself is indicative that person is nervous, because they feel severe burning retrosternally in epigastric region, and whenever that burning and that irritation over there, the irritation, if something comes out in vomiting, they feel relaxed over there, and that is very typical of the Nux Vomica. Stomach. The features of stomach are very important. Pressure an hour or two after eating as from a stone. So patient eats and after 1 hour, 2 hours, he feels that someone have put a stone in the epigastrium. That much hardness comes. If it comes immediately after, it is Calibicromicum or Nux moschata. These are two remedies. If it comes after 1 or 2 hours after the eating, that is the Nux Vomica. Pyrosis. There is a lot of salivation which happens to be there. Tightness, must loosen the clothing. So stomach, there is a feeling of tightness. There is continuous salivation happens to be there. Stomach cannot use the mind for 2 or 3 hours after meal. That is very important. They feel so disturbed that they feel, doctor, I could not concentrate on my work once I eat. And that's why I avoid to take food. Generally, after completing my work, I used to take the food because otherwise I could not concentrate. This is my problem. And it is because my GI system immediately get disturbed. I start getting irritations, I start getting burning and all those things, all that stuff which happens to be there after eating. And that's why this is very typical feature. Cannot use mind for 2 or 3 hours after meal. Stomach sleepy after the dinner. The person, as soon as he takes the food, he becomes sleepy. He cannot control the sleep. Stomach from complaints from anxiety, from worry, from brandy, from coffee, from the drugs, from night watching, and high living. What do you mean by high living? High living means it is the standard where they cannot eat normal food. They always want something very high, spicy, or which has more calories. Such type of food they have a habit of taking, as well as their whole thing. They never wants to do exercises. Everything is they want on table, on the in their hands, and absolutely a sedentary workers. Never wants to do anything by their own hands. That is typical with the Nux Vomica. So this whole paragraph is the state of the Nux Vomica generally with which patient approaches in our OPD. Most common entity in modern people is this. Many people who are office workers nowadays, they works in IT companies, they works in banks, they works in many offices, they works and the what you can say they do the computer works more commonly, and these people generally doesn't have a tendency to work hard or to go for exercises, and they suffers with all those stomach problems, and it is the remedy for that. So I think we'll stop over here, and remaining part we'll learn in tomorrow's session, because this is one part of it we have finished about the GI system. Up part, the upper part of the GI system. But it acts right from the mouth to anus. Whole system, it has its own action. So we have to learn it by heart again tomorrow. So we'll meet tomorrow with the remaining part of the remedy, and we'll discuss a few more cases of the Nux Vomica in tomorrow's session. Till that period, thank you very much. Thanks a lot. Any queries are there, we can have chat. Otherwise, we'll conclude. So we'll conclude today's
Sir,
session.
what is the genus of Nux Vomica?
What is the
Genus of Nux Vomica?
Nux Vomica? Only one word with around which Nux Vomica. In fact, whole story of Nux Vomica is with the two words, one word, that is ambitions. Tremendous ambitions. That is the thing around which it revolves. It is the genius, ambition. Most ambitious personality. If you open the repertory, ambition, money for, you will get Nux. Ambition, fame for, you will get the Nux. Both things Nux requires. If you open Lycopodium, there is only one thing. Lyco is ambitious for the money. Laches is ambitious for fame. But Nux is ambitious for both the things. That is very typical with the Nux. And whole story is ambition story in Nux Vomica.
Okay, sir. Thank you very much.
Okay. So we'll conclude and we'll meet tomorrow at the same time. Thanks a lot. Good night.
Good night, sir.